Clinical examination of the musculoskeletal system. So the musculoskeletal system or locomotor system basically involves muscles, joints, and bones, and also tissues that are inextricably linked with supports, protection, and locomotion. So the main symptoms patients complain of in the joint are pain, stiffness, swelling, instability, clicking, and loss of function. Pain is the most common symptom, especially in the lower lumbar spine. And the important questions are where and when. So where we need to ask the patient to point accurately the place where the pain is worse, and also determine whether the source of the pain is the joint, muscle, or other soft tissue structures. Bone pain is described as deep and characteristically worse at night. And muscle pain is poorly localized and is aggravated by contraction and skull contraction of the affected muscle. So when you ask the patient whether the pain is constant, as in which case it is probably inflammatory, or intermittent, in this case it is probably inflammatory too, or it could be mechanical. So if mechanical, what activity or position makes it worse, and what gives relief? Many chronic joint disorders and also heel fractures are worse in cold and wet conditions, although the reason for this is not very clear. For stiffness, usually this means a restriction in the range of movement of a joint, and this may be due to an actual physical limitation of movement, or because the movement is painful and therefore in practice is not made. So morning stiffness lasting up to 15 minutes is common in many joint diseases, but if it lasts for an hour or more, and this suggests an inflammatory arthropathy, intermittent restriction of movement which comes and goes suddenly, and this indicates a mechanical disorder, usually in the joint but occasionally in the tendon, and it works a tendon that works the joint, for example trigger thumb. Stiffness after prolonged immobility is likely to be due to osteoarthritis. Swelling, this is common to any joint problems, and if it follows an injury, then the speed with which the swelling appears is very important. Injury to vascular structures such as bone and ligaments leads to rapid swelling due to bleeding, and reactive effusion from injured avascular structures takes longer, hours or days, to produce a swelling. So its site obviously matters, but its shape too. If it defines a synovial cavity in the knee, then the swelling is likely to be due to fluid within the joint. Okay, let's look at instability. So this applies particularly to the weight bearing joints of the lower limbs, and it conveys a sense of insecurity. The patient feels that if he puts his weight on the leg, something bad will happen, or finds from bitter experience that it does so. And so this may be due to weakness of the muscles which support the limbs in the upright position, or it may be an abnormal movement which takes place in the joint. Okay, now let's focus on clicking and clanking. So noises coming from joints are not necessarily pathological. Some people produce less vacuum clicks, and in others noises are produced by tendons slipping over bone prominence. However, some noises, particularly those accompanied by pain, are very significant. Okay, so lastly, let's look at loss of function. So one must find out what function is lost and why. What exactly can a patient not do that he wishes to do? The examination should review whether the problem is paralysis or stiffness.